Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot. This is my second time. So again, be patient with me, guys. This is very new to me. I'm figuring it out. But we're going to be going over 10 questions that have concepts that have been seen on major nursing exams like NCLEX, ATI, and HESI over and over again. Not these exact questions, but the concepts you need to understand. So I'm going to go over them with you, and I'm very excited. As always, I'm going to ask you to please support me and support my channel by liking this video. You're going to love it. Press that like button now. Subscribe to my channel if you haven't done so already. Tell a friend about my channel. Don't forget, I have NCLEX review that you can book and audio lessons available on my website, nexusnursinginstitute.com. Let's get started. Okay, which of the following assignments by the RN would be appropriate for an LPN LVN? Oh, let me put this down. 34-year-old woman who's scheduled for myelogram in the afternoon, 41-year-old woman in traction with a fractured femur, a 43-year-old woman newly diagnosed with type 1 diabetes, or a 56-year-old man with emphysema scheduled to be discharged later today. And guys, it is the 41-year-old woman in traction. Why? This is the most stable patient. Whenever you get a test question about who are you going to delegate to the LPN or LVN, you have to choose the most stable patient. Very good, Yemi. True or false? Your patient in the ICU goes into VFib. Your first nursing action should be to start performing CPR. True or false? False. Your first nursing action should be to defibrillate, okay? You are going to defibrillate. Now, if you don't have a defibrillator, then you're going to do CPR. Or if you use a defibrillator and it is not stopping that dysrhythmia, then you start CPR. But when it comes to VFib, the first thing you're going to do is defibrillate. So that's why it's false. Next question. Patient presents with nausea, vomiting, and a temp of 101.3. Which action should the nurse take first? Assess the need of dietary teaching, assess fluid and electrolyte status, assess for allergies and health history, or determine if consent has been signed for surgery. You need to test fluid and electrolytes. They have a fever and they're vomiting. You're going to be concerned about fluid and electrolytes. Think physiological integrity, what keeps them alive the longest or can kill them fastest, okay? That's what you're going to do. Okay, Jess. Next, when caring for a patient with anorexia, which of the following indicates to the nurse that the patient's condition is improving? They eat all the food on their tray. The patient asks friends to bring special dishes. The patient weighs herself daily, or the patient's weight has increased. Patient's weight has increased, because guess what? They can ask for food, they can eat all their food, but it means nothing if they go to the bathroom to throw it up or they try to exercise a lot. But if they're gaining weight, we know that it's being effective. Okay, I see, Jess, you're keeping your top spot. Which of the following symptoms observed by the nurse during the first 24 hours after a liver biopsy would indicate a complication? Anorexia, nausea, vomiting, abdominal distension and discomfort, pulse of 112, blood pressure 90/60, respirations 22, or pain at the biopsy site. Remember, when a patient has had surgery, you are concerned about infection, DVT, pulmonary embolism, and what? Bleeding. It's going to be that high pulse, low blood pressure, high respirations, okay? We're concerned that that patient's bleeding out. Okay, Jess, you're holding on to your lead. Your patient just had a right-sided CVA with dysphagia. Which actions are appropriate by the nurse? Select all that applies. All right, guys, how do we treat select all that apply? It's true or false? Assess their ability to swallow. You better, you don't want your patient to aspirate. Position patient at a 45-degree angle. You better not. You want them sitting up. Position food tray on the patient's left side of visual field. If they had a right-sided stroke, they're going to be weak on their left side. So no, you need to have it on the right side. So that's false. Place food on the patient's right side of the mouth. Absolutely. And turn off the television. Yes, because you want to limit distractions. Okay, you have to know whatever side the patient has a stroke, the opposite side is where they're going to have the weakness. So you're not going to put food on that side. You're not going to put things on the visual field on that side. True or false? Patients with TB should be treated for a minimum of 6 months, but is normally treated for an average of 9 to 12 months. True or false? What do you guys say? And it's true, the minimum amount of time that they should be on those medications is going to be 6 months, but on an average, they're going to be on these medications for 9 to 12 months, and they're going to be on a cocktail of medications, not just one. After receiving a report from a night nurse, which of the following clients should the nurse see first? A 31-year-old woman refusing sulfate before breakfast, 40-year-old man with left-sided weakness asking to get up to the commode, a 52-year-old woman reporting chills who's scheduled for a cholecystectomy, or a 65-year-old man with an NG tube who had a bowel resection. Who are you going to go see first? Yep, that 52-year-old reporting of chills, they're scheduled for a cholecystectomy. Can a patient go into surgery with an infection? Absolutely not. The only time you do it is if it's a medical emergency, which means you have to do it or they'll die, right? So the fact that this patient's scheduled for surgery and they're exhibiting chills, which is a sign of infection, you better go check that patient first because they're most in danger. The nurse would expect to see which of the following lab results in a patient experiencing ketoacidosis: serum glucose of 140, serum creatinine of 5.2, blood pH of 7.2, or hematocrit of 38. What do you guys think? Think about it, ketoacidosis. So the patient will be in acidic state. That pH, 2.8, your normal pH is supposed to be 7.35 to 7.45. Lower than 7.35, they're in an acidic state. So that's what you would expect to see. Last question. A diabetic patient calls your office complaining of nausea and abdominal pain. You would advise the patient to do what? Hold the regular dose of insulin, immediately give the next dose of insulin, check your blood glucose now and every 3 to 4 hours, or increase your activity level. ADPI, right? You always want to assess first. You want to find out what's going on with the patient. Are they hypoglycemic or hyperglycemic? The first thing you're going to encourage them to do is to check their blood glucose. And guys, that is it. That's it for this, but I promise there is going to be more coming. Please, in the comment section, let me know what you thought about this video. Let me know how I can improve these Kahoots because I'm new at it. I really don't know much about it. Please let me know what you think. I'm going to be reading those comments and I will be implementing those suggestions that you think will make this video better. Don't forget, you can book for audio lessons on my website, nexusnursinginstitute.com, and you can also check out the audio lessons I have available. Thank you for watching, and you'll catch me on the next video. Matthew. 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 Yeah.
This thing was so hard.
Nana was able to see. Were you able to see the questions?
No, I was guessing.
Exactly.
No, were you able to see the questions?
No, I was guessing.
Exactly.
How are you guessing if you couldn't see the questions?
No, like you can't see the questions, but you can see like the choices they give you. So I kept choosing any choice.
Exactly.
You couldn't see the questions?
You couldn't see the questions, right? Yeah. Look at your TikTok comments. They all say you can't really see the questions. That's
For real?
Yeah, you have to show them your screen.
You should have like did a live and showed your screen. Look at your TikTok, Mama. Look at your
Yeah,
TikTok.
when you were live, what I told you, remember when I told you to flip your camera so they can all see?
Oh, you did say that.
Were you live or no?
Mhm.
They were all guessing then.
Yeah, they're all guessing.
To guess too.
We were all guessing.
No, do it.
Oh.
You're gonna make a new one.
Look. Okay.
And you're gonna go live this time. We're on our way home, okay?
All right.
That's what I was trying to tell you, Mama.
I know, but I was recording. That's why I really couldn't talk to you the way I wanted to. Right above, you will see the pen, the game pen to get in, or you can also scan that barcode. Hey guys, 6:30 p.m. Eastern Standard Time. I'm going to be on Kahoot. Come on, join, test your knowledge. Right above, you will see the pen, the game pen to get in, or you can also scan that barcode.
It happens.
Hey guys, oh my God. Eastern Standard Time. I'm going to be on Kahoot. Come on, join, test your knowledge. Right above, you will see the pen, the game pen to get in, or you can also scan that barcode. Hey guys, 6:30 p.m. Eastern Standard Time. I'm going to be on Kahoot. Come on, join, test your knowledge. Right above, you will see the pen, the game pen to get. Oh my gosh. Okay. Wait, let me close this. So I have a question. And meeting for all.